you'll see, there's room to grow.
Nearly every mum will come across the problem of nappy rash. It's so common and nearly every baby will get it. Now, to find out more about nappy rash, here today is midwife Leanne. Hi Leanne, welcome to Room to Grow.
Thank you.
Now, what is nappy rash?
Well, I guess as we know, all babies have quite delicate and sensitive skin, and they're in a nappy constantly, 24 hours a day. And sometimes what can happen is when a baby is wearing a nappy all the time, the urine and the faeces in the nappy can cause a chemical reaction and let off something known as ammonia. And ammonia can actually burn and irritate a baby's skin.
So that's what it is, burning of the skin?
Burning of the skin, causing a redness. Sometimes can be quite swollen and inflamed, and even have some blister-like areas around the buttocks area.
So is there different types of nappy rash?
Basically it's more just the red, swollen, blister-like, and it can develop to more serious conditions where small pustules form, and in those situations it's really quite important that you see your GP for a more specialised cream that you can apply to your baby.
Okay. Well, on that note, how do you treat nappy rash?
I guess the most important thing for treating nappy rash is changing your baby's nappy frequently throughout the day. It's advised normally that you would change a baby 8 to 10 times a day, and obviously more frequently if you notice that your baby is going to the toilet more often, or if your baby's awake and you've noticed that they've gone to the toilet, then obviously change the nappy more frequently throughout the day.
You can't change a nappy too much?
Not at
all. Too
all.
many times, really?
Obviously if your baby's fallen asleep, you're not going to wake your baby to change their nappy, but just making sure that before you put them down for a sleep that their nappy is dry and clean.
Is there a difference between the nappies, like with disposables and reusables, like cloth nappies? Do they make a difference with nappy rash?
Disposables do tend to be more absorbent, so the urine does become more absorbent. It's not sitting directly against the baby's skin as it is in cloth. But on the other hand, cloth nappies are great for our environment. So as long as you're changing them frequently, there's no better option, really.
Okay. Now, ways of treating nappy rash, one is obviously to change the nappies more frequently.
Yep.
What about creams? There's so many different creams on the market. I mean, there's creams like barrier creams, there's cream to actually help the nappy rash.
That's right. And if you go to your local chemist or your GP, they will advise you on the best type. There's zinc-based creams, paraffins, and I think things like pepanthen and pawpaw creams, which are also quite good for nappy rash. Some other things you can do is, if your baby's awake, is leaving your baby with no nappy on, popping a cloth or an absorbent towel underneath them, just giving them some nappy free time. That's right. And it just means there's not that direct contact of the urine against the skin. Some research has actually said sunlight helps against a baby's bottom. So if you've got a window, you don't want direct sunlight.
No, you don't want to burn them.
You don't want to burn them, but if they've got their nappy off next to the window, and getting some direct sunlight can help to dry that area out.
Just for like 5 minutes or something?
Yeah, just short periods of time.
Yeah, that's right.
And also making sure that when you apply the cream that the baby's bottom is quite dry before applying. And you want to apply quite a thick layer of the cream to the areas.
Now, that's if your baby actually has nappy rash. So do you apply cream even if the baby doesn't have nappy rash, just to prevent it?
Not necessarily. As long as you keep your baby's bottom clean and dry, that's all that's required. And just being careful of things like the types of wipes that you might use. Some wipes are very high in perfumes and alcohol, and they can irritate the skin as well. If you're noticing that your baby's bottom is becoming a bit red, switch from maybe using your wipes to a warm face washer with some mild
good old
water and sometimes even a drop of oil, just normal olive oil in your water, can help to keep that area nice and clean.
Oh, that's a good idea.
And I guess one of the other things is not using talcum powder.
Yeah, now what is the story with that? Because like in the old days, whatever that is,
powdered their bottom with talcum
used to have
powder.
baby powder and sprinkle it all over.
We just usually advise not to use talcum powder. Again, it has chemicals and things that can react, and it can become quite clunky on the skin when mixed with the urine.
Oh, okay.
It becomes quite thick and pasty.
So avoid talcum powder.
Avoid talcum powder.
So when it comes to cleaning your baby's bottom, is it okay to use soap?
Soap's fine as long as it's a baby friendly soap, something that's really quite pure and doesn't have a lot of perfumes or alcohol in them. But like I mentioned earlier, using just normal warm water and maybe a little bit of oil is probably better when a rash is around, rather than using something that could maybe irritate the area more.
Right. Now, are there different stages of when nappy rash is more prevalent, depending on a baby's development?
Yeah, there are some times when nappy rash tends to flare up, times when maybe baby's teething, or you're introducing a new solid into their diet, especially after the 6-month mark when you're introducing new foods. Sometimes that can be a bit irritating to their stomach. Obviously, might cause things like diarrhoea, which in turn will maybe increase the amount of nappy rash that they might have.
At what point do you consider it to be severe that you need to seek help?
Nappy rash is really just a rash around the bottom area. If it extends to anywhere else out of the nappy region, then you need to see your GP.
Okay. Well, it's been wonderful having you here. Thanks so much for coming.
No worries.
See you
Thank you.
again.